Hello, Everione.
My name is Dr. Edward Langley, and I'd like to take some time today to discuss a health concern that's incredibly important. You might be surprised to learn that even when you're sound asleep, your body isn't fully at rest. It's actually hard at work, quietly watching over you. From time to time, it may try to send you warning signals to let you know that something isn't quite right. Today, we're going to talk about one of those particular signals, which is related to blood clots. I know that for many people, the term blood clot immediately brings to mind a problem that only affects older individuals. You might think to yourself, that doesn't really apply to me, I'm still quite active and healthy. If that thought has crossed your mind, I encourage you to listen closely. The truth is that blood clots can affect anyone, no matter their age. Many seemingly healthy young adults, pregnant women, people who work at a desk all day, and even those of us who are simply feeling overextended can be at risk. I'm not sharing this to cause alarm. However, data from trusted medical sources shows that millions of deaths each year are linked to diseases of the heart and blood vessels that are caused by blood clots. What's especially noteworthy is that a large number of these events happen during the night or in the very early hours of the morning. Why is that? It's because when we sleep, our bodies are still for long periods, which causes our blood circulation to naturally slow down. This slower blood flow can create an opportunity for clots to form, and these hidden dangers often choose to surface while we are resting. So, my goal today is to help you learn how to recognize the distress signals your body might send you during sleep. If you frequently experience any of the 5 things we are about to discuss, it is very important that you pay attention. They could be serious warnings from your body about a blood clot. Before we explore those 5 key warning signs, let's take a moment to understand what a blood clot actually is. A helpful way to picture it is to think of the pipes in your house. Normally, blood flows easily through our veins and arteries, much like a clear stream of water. But if something disrupts that smooth flow, the situation changes. For example, your blood might become thick and sticky because of a poor diet and not enough exercise. Or, the walls of your blood vessels might become damaged due to conditions like high blood pressure or diabetes. When this happens, the flow of blood is no longer effortless. This is when the platelets in your blood, which are responsible for stopping bleeding, are called into action to repair the damage. They gather together with other clotting proteins to form a small clump. That clump is a blood clot. Medical experts have identified 3 key factors that usually contribute to the formation of blood clots. The first is when the blood itself is too thick. The second is when blood flow slows down or is obstructed. And the third is when the delicate inner lining of a blood vessel is damaged. When these 3 conditions occur together, they create a perfect environment for a blood clot to develop. If these clots stay in one place, they might not cause a major problem, at most affecting the blood supply to a small area. The greatest danger, however, is when a piece of the clot breaks away and begins to travel through your bloodstream. Once it detaches, it essentially becomes a mobile threat. If it travels to one of the coronary arteries that supply blood to the heart, it can cause a fatal heart attack. If it blocks a blood vessel in the lungs, it can lead to a dangerous pulmonary embolism. And if it makes its way into the brain, it can cause a stroke. In general, we divide blood clots into 2 main categories. One is arterial thrombosis, which often occurs in the arteries of the brain and heart. Blockages here are extremely serious and can directly threaten your life. The second is venous thrombosis, which most frequently happens in the deep veins of our legs. Please do not underestimate this type. If a piece breaks off, it can travel all the way to the lungs and cause that life-threatening pulmonary embolism we just mentioned. So, you may be wondering why people seem to be more susceptible to blood clots now than in the past. The reason is closely tied to our modern lifestyles. First, there's the issue of prolonged sitting. People who need to travel for long distances often sit for hours on airplanes or trains. Similarly, many office workers remain seated at their desks for most of the day. In these situations, the blood circulation in our lower legs can become very slow. The blood flow becomes sluggish, and clots are especially likely to form. A study in the respected British Medical Journal showed that people who sit for more than 8 hours a day have nearly twice the risk of developing venous thrombosis compared to those who exercise regularly. Second are unhealthy lifestyle habits. People who regularly eat foods high in fat and sugar, such as fried meals and sweet desserts, can cause their blood viscosity to increase. Add smoking and drinking to this, and the blood can become even thicker. For those who also cope with long-term stress and lack of sleep, the blood vessels themselves can become fragile, almost like a bridge that has fallen into disrepair, making them an easy target for clots. Third is the effect of certain diseases or recovery after surgery. If you already have a chronic condition such as diabetes or high blood pressure, or if you have recently had an operation and are still healing, your body's internal environment changes, which can make it easier for blood clots to form. For a person with diabetes, for example, long-term high blood sugar can continuously damage blood vessels, essentially laying the groundwork for a clot to develop. Understanding this background information helps us better appreciate why unusual signs during sleep are so important. Let's now look at the 5 sleep alerts sent by blood clots that you need to know. The first alert is experiencing swelling, pain, or cramps in only one of your legs at night. You might be sleeping soundly and suddenly notice that one leg, and it's important that it's just one, not both, is swollen. It might even feel warm when you touch it. There could be a persistent ache, almost like a squeezing feeling. Sometimes, a sudden cramp might even wake you up. This is a classic sign of deep vein thrombosis, or DVT, in the lower leg. As we've discussed, this is more likely to happen at night because we lie still for a long time, and the blood flow returning from the legs can be obstructed. This allows blood to pool, which naturally causes swelling and pain. 3 groups of people should pay special attention to this. First, individuals who sit for long periods, like office workers and long-distance drivers. Second, pregnant women, because the growing uterus can put pressure on the blood vessels in the pelvis, affecting circulation. And third, patients who have recently had surgery, who are often weaker and have significantly reduced activity. Data from the American Society of Hematology shows that about half of all patients with a DVT in their lower leg report these early symptoms. So if this happens to you, please don't just assume it's from a bad sleeping position or a simple calcium deficiency. Be alert. The second alert is a sudden feeling of chest discomfort or shortness of breath that wakes you from sleep. Imagine you are dreaming, and you suddenly feel as though a heavy weight has been placed on your chest. You can't seem to catch your breath, and you wake up gasping for air. You might feel the need to sit up immediately and breathe deeply before you feel a little better. If you have experienced this, you need to be highly aware that it could be a sign of a pulmonary embolism, which is an extremely dangerous condition. In the great majority of cases, a pulmonary embolism is caused by a clot that started in the leg. That bomb we talked about detaches, travels to the lungs, and blocks the pulmonary artery that supplies them with blood. This is like slamming the brakes on your body's circulation, causing a sudden lack of oxygen, which is very dangerous. In severe cases, it can even lead to sudden death. Medical studies have shown that if not treated promptly, an acute pulmonary embolism has a high mortality rate. However, if effective medical treatment is given within the first 6 hours, that rate can be greatly reduced. This experience of waking up gasping for air is definitely your body sending you its most urgent SOS signal. Our third alert is frequent urination at night or an abnormal color in your urine. Generally, most adults don't need to get up to use the restroom more than once or twice a night. But if you find that you've been getting up much more often lately, enough that it's affecting your quality of sleep, you should take note. It's an even more serious sign if you notice your urine has an unusual color, like red or a dark cola color. This might indicate that blood clots are affecting your kidneys. Our kidneys also need a sufficient supply of blood to keep them nourished. If the renal artery, which supplies blood to the kidneys, is blocked or narrowed by a blood clot, the kidneys won't get enough blood, and their function will be affected. This can sometimes lead to increased urination at night. If you notice that you're getting up frequently and have other discomforts like back pain or fatigue, you should see your doctor in a timely manner to check your kidney function and look for signs of a clot. Please don't delay. The fourth alert is feeling dizzy or having numbness in your hands and feet when you wake up. When you open your eyes each morning, you might feel dizzy, as if the world is spinning. You might see small stars flashing in front of your eyes or even have a few seconds of blurred vision where you can't see things clearly.
At the same time, you might feel numbness in your hands and feet, like a pins and needles sensation.
If this happens to you often, it is likely that a blood clot has quietly begun to affect the blood supply to your brain. The brain is the headquarters of our entire body, and it has particularly high needs for blood and oxygen. If there are blood clots in the blood vessels of the brain for a long time, even if they don't cause a complete blockage, they will lead to an insufficient supply of blood. This dizziness and numbness you feel upon waking is likely a condition called a transient ischemic attack, or TIA. It is critical not to underestimate a TIA. It is the most important prelude and warning before a major stroke, much like the dark clouds and lightning that come before a storm. Recognizing this signal and getting help in time is equivalent to winning valuable time to prevent a stroke. Our fifth and final alert is a frequent cough, sometimes even coughing up blood, while you are sleeping. You haven't had a cold recently and your throat doesn't hurt, but you find yourself coughing nonstop when you lie down to sleep at night, and it's mostly a dry cough. Even more frightening, sometimes you may cough up phlegm that has blood in it, or even fresh blood. In this case, you should also be highly alert to the possibility of blood clots in your lungs. When a blood clot blocks a pulmonary artery, it impairs blood circulation in the lungs. The air sacs might not get enough blood, which can lead to local tissue damage or even death. This situation will stimulate your respiratory tract, triggering frequent coughs. If the situation is serious, you may see blood when you cough. 3 groups of people should pay special attention: those who have been bedridden for a long time, patients who have recently had surgery, and pregnant women or new mothers. So, if you have an unexplained nighttime cough, especially if you cough up blood, please don't hesitate. Go to the hospital immediately for an examination. After listening to these 5 major alerts, I believe you have a deeper understanding of the dangers of blood clots. So, what should we do in our daily lives to effectively prevent them? The good news is, the answer lies in our own lifestyle habits. First, let's develop good physical habits.
Keep moving. Don't let your blood sleep.
The saying "life is in movement" is absolutely true. The American Heart Association recommends that adults get at least 150 minutes of moderate intensity aerobic exercise each week. What does moderate intensity mean? A good example is brisk walking. You could take a brisk 30-minute walk in the park after dinner, go for a swim, or do some yoga. These activities all promote healthy blood circulation. Exercise injects new vitality into your blood vessels, and blood clots will naturally not form as easily. It's also essential to avoid prolonged sitting. If you have an office job, remember a simple principle: for every hour you sit, get up and move for 5 to 10 minutes. You can stand up to get a glass of water, stroll around the office, or do a few simple stretching exercises. For those who need to travel long distances, also remember to get up and walk around from time to time to get the blood in your lower legs flowing smoothly. This small action can reduce your risk of blood clots significantly. And finally, give your blood vessels a clean environment. The harmful substances in tobacco directly damage the inner walls of our blood vessels, making them rough and prone to clots. For the sake of your vascular health, please resolve to quit smoking. It is also wise to drink as little alcohol as possible to create a healthy and clean environment for your blood vessels.
Second, adjust to a healthy diet.
Eat less greasy and sweet food. Those tempting fried foods, pastries, and cakes can make our blood thicker and thicker.
So, we must control our intake.
Try to eat less of these foods to help reduce the viscosity of your blood. Also, try to supplement with omega-3 fatty acids, which are like a scavenger for your blood vessels. You can find them in deep-sea fish like salmon and in some nuts. These fats have natural anti-inflammatory and anti-clotting properties. A study in a major clinical nutrition journal showed that a daily intake of omega-3s can reduce the risk of blood clot formation. And remember to drink enough water to dilute your blood. This is the simplest and cheapest way to prevent blood clots. The American Heart Association suggests that adults need to drink about 2 liters, or 8 glasses, of water per day. Sufficient water can dilute the blood, reduce its thickness, and make it flow more smoothly. Don't wait until you're thirsty. Try to drink small amounts throughout the day to keep your body consistently hydrated. Third, pay close attention to your body's signals. If you have a condition like diabetes, high blood pressure, or obesity, you are at a higher risk of blood clots. Medical guidelines recommend that people in these high-risk groups have regular checkups, which might include a vascular ultrasound exam at the hospital, perhaps once a year. This is like a physical for your blood vessels. Early detection and early treatment can avoid many serious consequences. And of course, if your body shows any of the symptoms we discussed, such as swelling in one leg, unexplained chest tightness, or dizziness in the morning, please don't guess or wait. You must see a doctor as soon as possible to let a professional help you find out what is wrong and take timely measures. Alright, Today we have explored the topic of blood clots in depth. To conclude, let's summarize the most important points together. First of all, please remember that this silent killer is by no means exclusive to the elderly. It can lurk in anyone's body. Friends who sit for long periods and have irregular diets should be particularly alert. Most importantly, our bodies, especially when we are sleeping, will send us valuable warning signals. From nighttime swelling in one leg and sudden chest tightness, to morning dizziness, frequent urination at night, and unexplained coughs. Any one of these 5 signals may be a blood clot knocking on your door. We must learn to listen and pay attention to them. I would like to remind my older viewers in particular not to simply attribute these physical abnormalities to getting older. Every subtle change in the body is your body's way of reminding you that there may be a problem with your health. Ignoring these signals is like giving a disease a chance to take hold. Remember to go to the hospital in time for an examination and listen to the advice of your doctor. This is the most responsible attitude you can have towards yourself and your family.
Please do not delay.
Of course, my goal in discussing this topic today is not to make you feel anxious or scared. On the contrary, it is to show you that you have the power in your own hands. Although blood clots are serious, they can largely be prevented. Starting today, stand up and walk around more to avoid sitting for long periods. Eat a lighter diet with less greasy and sweet food. Drink enough water every day to give your blood a bath. These seemingly insignificant small changes can build a solid line of defense for your blood vessels over time. Please remember that health is the most important cornerstone for enjoying a happy life. Love yourself by starting to listen to the voice of your body, and actively maintain your health with a positive and scientific lifestyle. I wish every one of you can have smooth flowing blood vessels and enjoy every day full of vitality.